Welcome to this episode of Athletic Training Chat. On this episode, we have Craig Lewin, who is an athletic trainer in the high school setting, as well as a teacher, but also runs Essentially Sports Medicine, which if you're on Twitter, you've probably seen Craig around. He's very active, but what he's focused on is essential oils and some of the benefits that they can provide for a lot of reasons across athletic training and sports medicine in general. And so in this episode, we really talk about how he utilizes those. There's a good reference sheet that we'll have linked up through this episode. Check it out on athletictrainingchat.com with some of the different essential oils and what they're good for and some recommendations from Craig. Really just an interesting look at how to use a different skill set in the world of athletic training. As always, we are powered by Mueller Sports Medicine. Please give them a look and support them for everything they do. They've got some surveys out there trying to understand what the world is going to look like for us going forward, so please check that out. Without further ado, enjoy this episode. Episode of Athletic Training Chat. We are on with Craig Lewin, who of esports medicine. If you're on Twitter, you've probably come across something that he's done. He's all over the place, commenting and liking stuff. The E, I think, was interesting, and I saw it one time, and he actually responded that somebody thought you were into esports, not the essential oils aspect of it, which I thought was kind of funny as that's become a thing in college. But before we get too far into any of that, I want to turn it over to you to just kind of give a little bit of background, how you kind of come to where you are, and ultimately we are talking about essential oils and different things and how it can be used within athletic training. So how you kind of got here.
Okay. I graduated from UWL in 1995 with my undergraduate in athletic training. So this May will be 25 years as a certified athletic trainer. I've had a varied background. I started out in clinical athletic training outreach, so kind of a sports medicine outreach, my first 5 years as an athletic trainer. While I was doing that, I got asked to guest lecture a bunch in high schools as well, and I was working with Lacrosse Aquinas, and I started my job athletic training wise didn't start till 2 p.m. So I did start substitute teaching for them in the mornings, and kind of fell in love with teaching. So in the fall of 1999, I decided to go back and get my master's in physical education teaching. So graduated with that in 2001, and then had my first teaching position in the fall, or actually it would have been, I graduated in the fall of 2001, and then in the fall of 2002, I had my first teaching job out in Colorado, and worked out there for 5 years, doing mainly teaching and coaching, and then athletic training on the side. So I kind of did some PRN work with the high school. We had an athletic trainer already employed by the school district, so he ran the show, and then I just kind of helped him. I coached football and track, so I mainly kind of helped during winter sports, like with wrestling tournaments and such, to be an extra individual to help with that. We ended up meeting my wife Sharon out in Colorado, and we got married, and then we decided to move back to the Midwest because she is from Cincinnati and I'm from Marshfield, Wisconsin. And so we found somewhere right in the middle, and that is where I ended up. And I've been in Valparaiso, Indiana now this will be my 12th year at Valparaiso High School. So I'm working as a as a physical education teacher, I do teach 2 athletic training classes as physical education electives. And then I also work as one of 3 athletic trainers at the high school with a stipend in addition to my teaching salary. And then there was few years, about 4 years, I did need to take a break during that 12-year period. Then I worked some PNR work, and then about 3 years ago, I came back on to work as an athletic trainer for the high school in that stipend position again.
So where or when, I guess, did the essential oils aspect of what you do kind of come in to play?
About 6 years ago, our son was seeing an occupational therapist, and he had recommended some essential oils. He had grown up as a missionary child. His parents were missionaries down in Africa, so they had used essential oils to keep in good health while they were down in Africa. So he had recommended that their son at the time was having some anxiety issues, and had recommended using some lavender, bergamot, and orange essential oils with him. And we saw that they were very effective in helping with his moods. My wife had decided that was right about the boom when Young Living and doTERRA were promoting essential oils, and my wife got a essential oil kit from Young Living, and in that kit we had one of the oils called Panaway, which I'm just going to show right here.
Mm-hmm.
It has wintergreen, clove, helichrysum, and see what else I'm missing, and peppermint oil in it. When I was doing my research, when she first got the kit, I had seen that helichrysum was really good with inflammation and helped with contusions, bursitis, and such. And during that winter, we had a lot of huge snowstorms, and I still shovel. I don't have a snowplow or snow blower. So I developed, one morning I'm driving to work and put my left arm on the door as I'm driving out of habit. And I kind of feel like it's kind of sore, and I look, and it's kind of squishy. So I had developed some bursitis in my left elbow, and I decided to try just, my wife's like, maybe we should get some ice for that. I said, well, from what I'm reading, this Panaway may work on it, so let's give it a try. And so I tested it out, and my inflammation went down, and within a couple days. So that kind of hooked me that, it wasn't just something for emotions or something to smell good, that this may be a tool that we could use as athletic trainers or sports medicine or healthcare professionals. So that was where we kind of got the idea. When I started out as an undergrad, I was undecided, and part of it was I was going to go physical therapy or business, possibly be an accountant. So I always thought about the business side of it. During my freshman year, I found out about athletic training. As big as the Marshfield Clinic is, we did not have a sports medicine program at that time, and there was no athletic trainers at my high school. So I just thought athletic trainers were physical therapists who worked with athletes. So
right.
So
yeah, I can understand that.
Yeah, so I found out my freshman year, somebody on my floor was in the athletic training program, and so I looked into it and then applied and got in as a sophomore into the introduction class. So so I always thought I would like to do a business as long as I was something I really loved the products. And with Young Living, as a family, we fell in love with the products. And like I said, they have a lot of different products. Not all of them can be used for sports medicine, but there are some of my favorites that I do order and donate to our school that we can use them in the athletic training room.
So I definitely want to get into more of the application. You reference using the one with inflammation and just some of those other things. But before we get there, my wife got into it for a little while. She's a big believer in thieves. Anytime I sniffle, that is what she wants to utilize. But even from my end, I haven't done the research on it. But like, what are essential oils, and what, if you can say it makes them effective, if there's a good way to put that into words, why that might be effective?
Okay. The essential oil are derived from plants, so they extract the oils. So basically, each plant has fatty oils as well as kind of the essential oil. The essential oil is more of the aromatic. Starts as a liquid, but can evaporate into a gas. And the essential oils can be used on the body 3 different ways. And so the main one that you see with aromatherapy, with the aroma, that it is inhalation is probably the primary way that's been used, but it is also used topically, and also with some people decide to ingest essential oils. So athletic training wise, we only use aromatherapy, diffusing it, and use it topically. What I think makes them effective is that there is studies that show through inhalation that it affects the certain areas of the brain that control mood and pain control. So that is where we like to use it. Also, is the essential oil is easily absorbed by the skin, so it can also get into your bloodstream or into the tissues that you rub it on. They've been used for, since biblical times. Even some of when you look at your different sports medicine rubs and creams and such, like BioFreeze uses peppermint wintergreen oil. So all those different type of analgesic rubs have essential oils in them. Some companies have, I guess, more therapeutic effect, and it just, as the boom started, more companies and pharmacies and such try to get in on the essential oil craze. So not everything is the same, and I like to compare it kind of to tape. If you're going to go to Walmart and buy a roll of tape, what we're going to get from our medical supply people, from Myotech and such, is going to be a lot better tape than that roll that you're going to buy on the shelf at Walmart. And I think that's the same thing with essential oils, that you kind of get what your money pays for, because you got to find the companies that are doing the scientific extraction to get the therapeutic effect. So Young Living is one of those. And there's more than one company. Young Living is not the only company with a quality essential oil out there. We just kind of, when we were doing our research, they had been around the longest. And so that's who we decided to go with, and we've been happy with them. But soil, I guess also I'd like to compare it to almost like, wine, that, the soil, how the plant grows makes a difference in the quality of the product.
Sure.
So you want to make sure the companies kind of have their own farms and that they have strict standards on how they're growing the plants. And then it's also when they harvest and do the distraction or extraction, they're going to get it at the levels temperature-wise. They're going to keep as many of the compounds that are in that plant to get the therapeutic effects.
Apologies for the hacking dog in the background.
No problem.
Yeah, unfortunately,
ours will probably run through pretty quick, pretty soon as well.
Yeah, unfortunately, he's getting a little old. Um, so just going back to your one, you talked about the inflammation with your elbow. Have you found anything that you've kind of in traditional athletic training, and that's in quotes, that you've kind of shifted in your practice? I know like ice has come under a lot of scrutiny, just more so recently, and people using more movement or the different e-stim machines, or even potentially something like this. Have you found anything that you've I hesitate to use the word replaced, but or maybe augmented um, to go more of the essential oil route than again quote traditional practices?
I do. Again, I do like to use essential oils along with movement, a little bit more than ice, but it's if I'm not gonna, I don't force essential oil on athletes. I always explain what they are. Would you like to try them before I use it? And usually, again, I won't put it on everybody that's complaining of pain. It's usually the stuff that is going to be more than a day or two. Something that might be a week or longer for injuries that they're going to have to recover from. Um, I do say I probably use less ice personally, but again, I if an athlete wants to use ice, I'm still gonna let them use ice. I'm not gonna tell them no, you can't use ice. I do try to say that there's not good research showing that it helps with inflammation. That mainly the ice is good for pain control, and some people love icing for pain control. I'm one of those people that for pain control, it's awesome. I've gotten used to it. Started spraining my ankles as a freshman in high school. I probably would beg to differ. I did not like ice then, but it's something I got used to. But if inflammation is under control, and heat works better for somebody, we'll switch to heat a lot sooner, and then again, trying to get them moving as quickly as possible. We are looking at getting some of the we're updating our athletic training room. We're supposed to have a new athletic training room and weight room facility this in October. I don't know how much it's going to get pushed back now because of what's going on, but I know we're looking at the HIVA mat and also using either Compex or can't think what's the other company with the
Mark Pro.
That's it. Yeah. So looking at maybe getting one of those 3 units to have in addition to kind of help promote active movement.
Definitely. Anything else specifically to essential oils in athletic training that you would like to cover that I didn't ask you about already? Because I know we have some questions about secondary setting now that you've been in it for a while, and some other things as well.
Essential oil wise, what we're using in the athletic training room, we do use the diffuser that's right to the left of me. We do use that quite a bit, almost on a daily basis. We don't run it nonstop, but usually about 15 to 30 minutes at a time. And so we'll use essential oil blends like Thieves and Purification that will help clean the air. Again, Thieves has the cinnamon and clove and rosemary oils and eucalyptus oils in there that help clean the air. And Purification has lemongrass and tea tree oils in it that also help clean the air. So we kind of alternate, just kind of mix things up. We use that for cleaning the air, and a lot of times we'll do that when the athletes aren't in there. And then we rotate orange, lavender, and eucalyptus globulus on days because there have been some scientific research showing that they're effective in reducing pain levels in patients. So some ERs and doctors' offices are using them to diffuse in the background. And they've noticed that when they have patients rate their pain on the 10-point scale, that when they're diffusing that, it's lower. So it does help with that. And we've had some instances where had a grip lock injury with one of our gymnasts where she had a compound fracture of her radius and ulna. And then we also had an ankle dislocation this year that I keep some of the oils with me that I'll put eucalyptus on a gauze pad, and kind of as they're laying back, as we're splinting them, and as they're taking the ride to the doctor's office or to the ER, I placing a few drops of the oil on the gauze pad kind of helps give them a little bit of a distraction, and again helping with some pain control until they can get on some other medication.
For sure, I'm sure at that point they will take anything that is easy to apply,
Right.
if it benefits them.
Yeah. And then in addition to that, then we do use several different oils for topical application. And so basically the minty type oils, your wintergreen, your peppermints, spearmints, all those are really good for pain control. And then some of your herb type for cooking, majoram, basil, those are also good for kind of muscle relaxation, lavender. So we use blends that help with that when we're doing some of our soft tissue work. Heliochrysum is another big oil. It's very expensive. The harder it is to extract the oil, the more expensive it becomes. So if you bought a bottle of pure heliochrysum oil, a 5 milliliter, which is, again, this smaller bottle has about 85 drops. That can run you $85 to $100 for a pure bottle. So we use the blends that have that are in there. So Young Living's Deep Relief blend, the Panaway I just showed, they all have heliochrysum in it. Another one, Aroma Seas, there's all that we use with muscle cramps, has heliochrysum in it. So we use some of those blends with our soft tissue work.
Okay. Yeah, I feel like that'd be a really interesting way to use it. Is that something that you use just, putting a couple drops with like lotion you're already using, or is there a specific lotion you use, or is there anything out there, or if there is it a hoax?
No,
the lotions that come with it already in it, what's maybe the best way to go about that?
I mean, you can buy, so like the Deep Relief is a roll-on that it's already pre-diluted with hydrogenated coconut oil, so it's at a liquid. But the Panaway does need to be diluted, so you just kind of have to read your bottles. If it's already comes pre-diluted, you're good to go. Otherwise, like Panaway requires 4 drops of a carrier oil, so you need to use something that has the fatty oils. So
Gotcha.
coconut oil, olive oil, avocado oil, those are all ones that can be used. I've also mixed it with cocoa butter. So that's something. So depending on if you want more glide, you're going to want to use more of a liquid oil. If you want something to have a little bit of resistance when you're doing your soft tissue work, then I would use a cocoa butter. Okay. Young Living does have its own vegetable oil complex, so that they can use. And again, you can go ahead and just put a drop Panaway and then put a few drops of this, and then you're ready to go with that as well.
Awesome.
And I guess the reason why behind peppermint, wintergreen, some of those, if you just put it directly on the skin, can irritate the skin. So if you,
Okay.
and you probably have seen that when somebody puts on too much biofreeze or something, that they
Sure.
do get skin irritations from it, is because it's, too much of that compound, and so it needs to be diluted. So that is why you do need to, if it doesn't come pre-diluted, got to read the bottle instructions and see how many drops you need to add. And just like anything, some people are more sensitive, so it's good to have, if you're going to use them in your athletic training room or a clinic, make sure you have some type of carrier oil on hand to dilute if they are having any skin irritation from it.
That makes sense. Kind of switching gears to just talking a little bit about the secondary school coverage. As like we mentioned, that you spend a lot of time there in kind of different capacities. What are your thoughts on getting people into secondary schools and how, as athletic trainers, and how that's coming along?
I think in our area, we're seeing in Northwest Indiana, we're basically a suburb of Chicago, on the, being an east suburb of Chicago, but being on the Indiana State side. There are a lot of athletic trainers at schools, not all of them. Some of the bigger schools like excuse me, some of the bigger schools like Valparaiso High School, we do self-employ 2 of our 3.
Okay.
Because we're also both teachers. Our 3rd athletic trainer is through a nearby clinic, Lakeshore Bone and Joint. And then some of the other schools either go through Lakeshore Bone and Joint or Community Health, which is in the area. So we are seeing kind of an increase of that clinical outreach coming back. So I do see at least one athletic trainer at all of our schools in Northwest Indiana. Excuse me. I do think they're definitely needed. I know some schools like Crown Point, which is about 20-25 minutes down the road, they've started getting clinical outreach athletic trainers to cover their football and wrestling events. So I am seeing it starting to go down into the middle school level. And as an athletic trainer, I do think we need, if you're going to have a sports program, you need to have an athletic trainer on site. Just from an AED along with that, just showing on social media how many athletic trainers have been able to help save people's lives this year with using an AED and performing CPR, knowing that every minute counts with surviving from cardiac arrest, that you want to have athletic trainers at practices and at events. And that's, I'm glad that we're seeing that increase at the high school level, but it needs to also trickle down into the youth sports and middle school levels as well. And hopefully in the next 5 to 10 years, we'll continue to see that.
Kind of going on from that, a lot of, even more so, kind of the craziness that's going on now. PRN athletic training, is something that you've done. I've done some on the side in my career, mostly now in hindsight, thankfully, through a clinic or something, not necessarily just me freelancing by myself. But as people are looking to do that, something that you've done, some best practices that you could provide them, because yes, the money can be attractive, but is it always worth that with some of the other things that you got to take into consideration?
Right. I guess if you're not working through a clinic, kind of creating your own contract, making sure you have something in writing that you're going to get paid such and such amount for the entire day, or such and such amount per hour. athletic trainers need to include that travel time. So again, I may, especially if it's a one-day event or a one-time thing, if it's here, right here in Valparaiso, Indiana, I may not charge as much as if I have to go 30 minutes down the road. That's, another hour of my time traveling to and from that event. So, um, so as you're setting up your contract, make sure you look at the big picture. How much travel time is going to be involved? How long are you going to be there? Does the venue have an AED? They don't have an AED. I won't work the event. Okay. If I would ever go into doing more PRN work, I would probably look into purchasing my own AED to have if I'm going to make that my full-time business. Just because with our training and our background, it's a must, and doesn't matter if you're doing little league baseball where a kid gets hit in the chest with a ball. We can have cardiac arrest there. To this year or a couple of years back, one of our neighboring cities, Lake Station, had it was basically spring season basketball, just spring league. An athlete went into cardiac arrest, and they pulled the athletic trainer off of the softball field. She was covering the softball event and saved that kid's life. Before I came to Valparaiso, I was an athletic trainer at Lake Station, and I was also a teacher at the school that he was playing for. So it just kind of hit me kind of right there at home. I've been blessed and lucky that I've never had to use an AED or perform CPR besides doing a Heimlich maneuver. But I'm ready when that time comes. But kind of hit home that that could have been me when I was either working at that school as a physical education teacher and coach, or when I was at Lake Station working as an athletic trainer for them. So I guess make sure you have that AED, and then and whether it's you personally buy one yourself or that whoever you're working for will have one present. In addition to that, you need to know, are they going to be providing the supplies? So when I worked PRN for a clinic, they provided all the first aid supplies and tape and pre-wrap. So I was happy with working for $30 an hour. Okay?
Mm-hmm.
But if that was going to come out of my end, where I'm supplying all the first aid supplies and tape and pre-wrap and splints and crutches and such, then obviously I might charge more per hour. So you kind of have to figure that out when you're picking up these PRN jobs to make sure it's worth your while. Early in my career, I fell into sometimes volunteering my time, but as I've gotten older, I only volunteer for nonprofits. So I do provide some medical care for when we host Special Olympics type things here in town. But otherwise, if you're holding a tournament, I do expect it to get compensated and not do it for free.
Do you have any best practices that you would kind of relay to people to demonstrate their value? Because I know for me, it's just it took us a little while to get to the $25 an hour we're currently at for covering camps on campus. It had been 20 forever. And we just made the shift to 25. And even for some of these other things, everybody's going to come to you with the story of, oh, well, we run this tournament, but we don't really make any money, and everything like that, which is, and kind of by nature, I feel like as a profession, we want to be helpful. Like you said, just used to volunteer your time. But how have you gone about communicating your worth and then just being able to stick to that to, again, make it worth your while. Because I think all of us would probably think, rightfully so, we're worth more than probably we get paid, but that doesn't always necessarily happen.
Yeah. Well, I mean, I guess for the PRN stuff, I would say have them go ahead and call an EMS or fire department and see how much it would
Good
cost.
call.
How much it would cost to have one of those guys sit on site while you're running your tournament or your event, because it's pretty spent.
That is a very good point. Yeah, you're a bargain at that point.
Right. So that's kind of what I use for demonstrating my worth. And then also saying how much if somebody's going to get, whether they do personal training or such, that, our best personal trainers in town make 30 plus an hour. And I think even actually are one of the best places in town. I think that it's 30 or more per half hour slot. So,
okay.
I mean, two different apples and oranges, but
right.
But I know if just looking at professions, that you're going to be there to help, save a life and make sure that if there is a bad injury, that it's taken care of the appropriate way, that keeps them from, again, maybe having a possible lawsuit and such. So again, look at what's your cost of hiring a different medical professional. It's also the cost of you going to court over something
Sure.
that was handled wrong or you had the lack of a healthcare professional at that tournament or event.
Those are all really good points. Anything else you want to cover before we kind of move into those athletic training chat 5 questions we have?
Trying to look at my notes.
And again, just we kind of talked about this offline, but Craig's put a bunch of resources on the different types of oils and what they're good for that we will put into a little document that you'll be able to download when this episode comes out. So there'll be plenty of that information ready for everybody.
I guess one thing, going back to either whether it's PRN or secondary school setting for ATs, is to make sure that I think schools, some of them are very happy just to have one athletic trainer, but I think ideally we need to have 2 on staff. Before I went back to get my teaching degree, I was kind of the lone wolf at the schools I was at, and that did create a lot of burnout for me. And one of the reasons why I was like, I'm kind of burnt out on, trying to be everywhere and taking care of everyone and not having days off. That you need to be able to take time off when you need it, when your family needs it, and a lot of other professions, nursing, most of the schools I've worked at have more than one school nurse, so, and kind of that same reason. So when something goes on that you maybe need to take care of somebody else medically at home or yourself, or you need a vacation, the school is still being covered with another healthcare professional, another athletic trainer, when you can have that day off. So I know I'm definitely in a blessed position right now where we do have 2 full-time athletic trainers at my high school. I'm one of them, and then we have 1 PRN position. So that does allow us to take time off, or so if we need to go do something right away after school for an hour, somebody can fill in for an hour while we have to go pick up medication, pick up a child. whatever the case is. Having 2 athletic trainers at each school would be definitely ideal, and schools need to look into that if they're having sports programs.
I think that's a really good point. Well, then kind of moving into these questions, you kind of referenced it in here, but I think it'll come up again. Where do you see athletic training going in the next 5 to 10 years?
Next 5 to 10 years, I do think we see more youth, more club, more middle schools having at least one athletic trainer present, and I think we're in the 30 to 40% of having a full-time athletic trainer at high schools nationally. I think all those different levels should see an increase in athletic trainers being present at school sporting events, and again, youth and club sporting events. I do also, I guess, one other thing that I've thought about doing, and seeing that other people are doing it as well, is more setting up kind of a cash only business for preventative programs, whether it's like ACL prevention programs or just injury prevention programs in general, and then recovery rooms and rehabilitation. So I think as we're seeing some pioneers already have started that more people may decide to go that route as well. And I guess also, since we have a lot of athletic trainers helping out with the hospitals right now due to the COVID-19 virus, maybe anticipate that we'll have more athletic trainers that are using their skills in doctors' offices and clinics as well in the next 5 to 10 years as they see our skill set.
Yeah, it's unfortunate that might be a thing to highlight it, but definitely a huge piece of it. And to all the people that are out there doing those positions, I know a couple of them here in town are doing that. Just say thank you to them since we brought it up. What advice would you go back and give yourself as a young athletic trainer if you could just go back and be like, hey, listen to me?
Athletic training is not your identity. It's not. I mean, I know that it's something that we love to do, and it applies to any job really. But a lot of times, especially as males, our identity is found in our jobs, and I would, as a young athletic trainer, definitely I would say that I considered my identity my job.
Mm-hmm.
So just sometimes we kind of get, especially when we're younger, get a little more tunnel vision. That kind of look at the big picture. That you're more than just your job. You're a son, you're a daughter, you're a mother, you're a father, you're a friend to others. Make sure that you're taking time to schedule family time, friend time, and me time, so you don't go through burnout. Athletic training does have, especially since not every school is blessed with more than one athletic trainer. So there is a tendency that if you don't take the time to have family, friend, and me time, you sooner or later you will burn out.
Right. What has been one of the most influential resources that you've found in your career?
I would have to say definitely the internet. It's kind of a funny story. So graduating in the spring of 1995, uh, and talking to one of my classmates, and he's like, "Hey, we got right during the spring of 1995 is when we were issued our college email addresses."
Okay.
And so he's like, "Hey, we got email addresses," and I'm like, I kind of blew it off and said, "When am I going to use that?" So
Yeah.
25 years later, obviously it's used quite a bit.
Right.
Do a lot of communication now that we're doing online teaching. At least through May 1st, it's a big thing. But I would say that in addition to that, just the ability to use YouTube, Twitter, Facebook, kind of just starting to dabble with Instagram.
Hmm.
I think I'm mainly because I find stuff on Facebook and Twitter that links to Instagram, but
Okay.
but seeing different ways that people are stretching, different ways that people are strengthening athletes, different techniques, and I guess that is one of those things that it's definitely open up my mind that there's not always one way or one tool to do things with in sports medicine. So,
Yep.
two things that I've really enjoyed kind of looking into, and they're pretty expensive, I think, for if you take the actual class, if you have to go, but is the postural restoration that I've seen that Ron Ruska from Nebraska, he's a Nebraska physical therapist.
Yep.
Postural restoration techniques. That has been something that has been pretty cool that I've found on the internet. And then also some of the myofascial stretching. I guess the big thing is just how important your diaphragm is with breathing and making sure that you're breathing correctly, and that if you're hyperventilating and not doing deep breathing, that it can affect your shoulder, it can affect your hips, it can affect your quads and your hamstrings. So that's kind of a new topic that I would have never came across if it hadn't been for the internet.
I can understand that. If you could change or eliminate one thing, could be a modality, a common practice, a mindset, whatever you want it to be, in the field of athletic training, what would it be?
That I guess is that what you were taught in college is sometimes will be right, some of it may be wrong. That everything we do is a science, and that science changes. So just whatever you learned in college, you can't be set in your ways that this is the only way to get this injury or illness better. That we're constantly evolving as a science, and that not every patient or athlete are going to respond to a similar treatment the same way. So you're going to is making sure that, again, that you diversify your toolbox, and because again, when something that you use regularly with athletes and it doesn't work, you got to kind of find a way to help athletes get better or feel better, and it may require using a different tool that you've never used before.
I couldn't agree more.
So sometimes, but as great as the internet and social media, that I'm finding things that are new to learn about. I do see a lot of bashing of athletic trainers that maybe use some tools that are outside the box, and sometimes since it's something new, there may not be a lot of research on it. So I guess that's something I'm interested in doing down the road, is if it's without going on to get a PhD, I would like to be able if I'm able to do some research on essential oils or other stretching and strengthening techniques, I would definitely, that's something I would be interested in doing down the road. Just if it ever comes down to where we could do that without having to be linked with a university.
For sure. No, I think that would be fascinating to look at. Last question is, what does being an athletic trainer mean to you?
I think athletic trainer to me is, again, being a healthcare professional that is here to help athletes and patients be active individuals, remain healthy and stay healthy. And if they get broken, we'll help them get back to that healthy state or wellness state.
Well said. We'll link up everything you sent in the show note thing with all where people can find you. But if people wanted to connect with you, what is the easiest route to get a hold of you, for questions or ideas or, who knows, potentially research down the line?
The best way would be to either send me a message on Twitter at esportsmed is my handle. And then also they could call my business phone, which is 219-237-9223.
Awesome. And we'll have all of that on the webpage when we get this episode live. So when this is out, go ahead and look there, people, and we'll make sure that you have hyperlinks to all those things.
Yeah. I do have we do have our website, Facebook page, and then I said I've started an Instagram account. Haven't put a bunch on there, but may in the future. So
fair enough. Well, Craig, I really appreciate you taking the time and sharing some of the information on essential oils.
It's my pleasure. Thank you for having me, Joel.